Dear viewers, today we delve into the complexities of transparency, accountability and anti-corruption in the health sector. My name is Derick Masette, 20-year-old Senior 6 Vakis Kakira Secondary School. I'm joined by medical personnel. I'll not mention his name but allow him to talk to us. Sir, please talk to us.
Yes, thank you for the opportunity. My name is John, medical clinical officer working with Kakira Secondary Hospital.
Thank you very much. Let's talk about lack of medicine in hospitals. When we see lack of medicine in hospitals, is it enough justification for lack of accountability from the administration of the hospital?
The best is no. It is not. I would attach the lack of medicine in hospital to factors like economical, political factors. I can attach it to issues with the supply management or with procurement, but not accountability, because I believe accountability is always done.
In many cases, we see more of government tuyambe from the public, instead of them demanding for accountability from the government health workers. How can we demand accountability effectively from the government health workers?
Yes, the first I would think is providing self-centered approach system. Here, what I'm trying to mean is the patients can easily share their information with patients, and also the patients can as well share their information with the health workers. So decision making is made by that.
So when you look at a very recent corruption scandal that happened in Iganga municipality, where one of the doctors stole blood from a government hospital where he was working and took it to his private hospital, what is the best response in terms of punishment to such an unacceptable act?
This is very interesting. The first I would think is we investigate to find out how true is it. Where did he take the medicine? Yes. Then the other thing I would first say is we should look into the pockets of this person. How much is someone earning? Is he earning well? Is the money coming in time? Because if money comes in time and is much, then such acts ought to be what? Won't be available. But if someone is earning okay and still continues to do such an act, then yes, we can terminate such a person or can cancel him out of the system.
So does cancelling a person out of the system involve revoking the license of the person?
Definitely, because that is what could be done.
So in the era of exposed corrupt, social media has become a battlefield where corruption is fought. Is exposure of the corrupt an effective tool of fighting corruption?
It is effective, because if today one person is exposed, the other knows thinking of doing the same act with fear. So I think it can work. It can work. Exposure of these people can work very well.
So wrapping up the discussion, as we strengthen partnerships in the fight against corruption, Doctor, what are your prescriptions for all the stakeholders in this anti-corruption war?
Okay, these agencies are paid by taxpayers in order to eradicate corruption out of the country. So my prescription would be, let these agencies exhibit the highest sense of transparency, accessibility, and accountability to the public.
Thank you very much, sir. Dr. John has said it all. And I also want to add that it is imperative for us to recognize the fact that we all are stakeholders in the anti-corruption agenda. And so we must recognize our responsibility in fighting corruption. If we can have less of government tuyambe and more of Gwanga Muje, then we'll be rightly positioned to win the anti-corruption war. Derick Masette, for God and my country.